So a podiatrist is a doctor that treats any ailment or deformity of the foot and ankle. So we focus on things like arthritic pain, bunions, hammer toes. We even deal with fractures of the foot and ankle, those kinds of things, any sort of soft tissue nerve problems. So any problem that you have with the foot or ankle is what your podiatrist is going to deal with. The most common causes of foot pain that I see here in my clinic are things like plantar fasciitis, arthritic pain. I occasionally will see things like neuromas, and in your elderly patients, I think it's more like arthritis and some things that we call like metatarsalgia, or just kind of pain in the balls of the feet. You know, to start out with like a neuroma, that's usually what we call it. It's an entrapment of a nerve that's between two bones in your foot. If we look at this foot model here, a lot of times it's between the third and fourth toes, and it's an entrapment of the nerve back here behind the ball of your foot. That can kind of feel like to the patient like they have a lump in their shoe, or they have some sort of shocking sensation, maybe even a numbness or burning sensation. And those, typically we treat those initially with some sort of padding, some orthotics, maybe even a steroid injection to try to get the nerve to calm down. If we're talking about things like arthritis, in elderly patients, I see that more in the ankle. We see it a lot in the big toe joint back here. Those things we typically treat initially with some sort of anti-inflammatory, whether it's oral or even, again, another steroid injection to try to get the inflammation to calm down. What happens in arthritis is the cartilage wears down and they have exposed bone. And when those bone surfaces rub on each other, that causes pain. When it comes to things like plantar fasciitis, that's a pain in the heel. They typically feel it on the bottom of their heel, more towards the inside. Really, it's an overuse injury. It's not directly tied to a specific injury. And it's inflammation of a fibrous band that goes along the bottom of your foot, kind of helps form your arch. And again, treated a lot of times with a steroid injection initially to try to get some calm down. We'll have them do some exercises to try to stretch out that band. Anti-inflammatories, again, orthotics or anything similar to that to try to pad the area, kind of help sometimes even alter their biomechanics or the way they walk so that we can relieve some of the pressure to the heel. In my mind, if you stay in touch with the podiatrist or have regular visits with the podiatrist, those are things that can be pretty easily prevented in most instances.